It's been really busy here, but definitely fulfilling. I'm excited about the work that we have going on with the patient screening hotline. You know, we started this hotline from scratch and figuring out our processes.
We had to develop pretty much everything, and we had to do it really fast. So we developed workflows, specific scripting for our nurses to follow, decision trees based on the patient's symptoms. We held, I think, 4 training sessions in a matter of 5 days and built our team from 4 nurses to 60 in about a week's time. Response we got from the public was overwhelming, and we quickly realized we have to staff up this team very fast.
It was ringing so much that the nurses couldn't put down the phone between calls. It was one to the next to the next. And we started 9 to 5, and now we're 7A to 11P, and our nurses are busy.
Yeah, so Friday made 3 weeks that we've been live, and we've helped over 9,000 patients.
I think the impact that we're having, I think of the totality of the patients that we've served and sending them to the correct point of care, what that's doing for our community, as well as our fellow employees that are working in the facilities to help reduce the burden of the patients that they're seeing. That's really rewarding. When I have time to reflect on that, that's extremely meaningful for me, and that keeps me going. I feel like our work is important and it's having a significant impact. Our team is incredible too. As stressful as it is, we laugh a lot and we have a good time. We're able to debrief with each other, and that's really helpful.
And we try to be very supportive of our nurses and keep them as educated and in the know as possible. And I think we do that really well. We hear that a lot from the nurses is, thank you, we feel the support from you. Thank you for keeping us educated. Thank you for keeping us informed. So the appreciation on the nurses' side to us for even creating this hotline and creating this workflows for them has been really great too.
I'm really thankful to work at a place like LCMC because they empower the employees to do things like this, to take on projects that Cheri and I have never run a hotline before.
Yeah, this is not our normal job.
But, you know, they give us the tool. They say, like, this is important. This is what LCMC is doing, and this is what we stand for. And we're putting all of our trust in you and run with it. And that's a really fulfilling place to work.
We appreciate that leadership that LCMC gave to launch this hotline, because we think it's done so much for our healthcare workers. It's done so much for our community. We'll never be able to determine for a fact the risk that we've minimized by launching it, but we've certainly geared patients toward a proper point of care. Patients in our community could call the LCMC Health COVID-19 Nurse Screening Hotline at 962-6202. If you or a loved one is experiencing potential signs and symptoms that you are concerned could mean exposure to COVID-19, please call the hotline where you can be screened by a registered nurse, potentially scheduled for an immediate virtual visit with a telehealth emergency room physician, and properly pointed to the correct point of care within our system.
The hotline's open to everyone and anyone in our community, regardless if you've ever been seen by an LCMC Health provider before, and it's completely free. So please give us a call.